through some of the images here for interventional radiology. So this one here, you've got two images. So you've got the first slide here that's the patient has stenosis or narrowing in their carotid artery. So you can see here where that arrow is. See how this artery would normally just come straight up here? Well, it's narrowed down to a very small portion right in here. So this first one, that patient has narrowing or stenosis, and then after angioplasty, where they put a stent in, you can see how they've opened that back up. Now you can see, due to the contrast, the idea of what the blood flowing would look like. This is a carotid angiogram. So there's two different views here. So this one's labeled. So you can see the right and left carotid arteries here coming up on the patient. This one doesn't look like it has any blockages or anything. It looks pretty good. This is an aneurysm of the internal carotid artery. So you can see here the contrast coming up, and then right here, see this little round ball right here? This is the aneurysm. So remember I said the wall lining kind of weakens, and then it's like an outpouching there. So what happens is that when the blood flows up in here, it goes into that aneurysm, and it doesn't necessarily flow back out, so it stays in there, and it puts pressure on that wall of the artery, and that's what can actually cause it to rupture, is the pressure of the blood. So then if the blood comes out of there, it's flowing out of the artery. So there's a couple different procedures that they can do. For that, one is coiling. Once an aneurysm has ruptured, then they need to clip it. But if they can catch it prior to rupturing, then they can go in and put a coil in there, which will help prevent that. This is stenosis of the internal carotid artery again. So again, here you've got normal blood flow, and then you can see the narrowing here, and the normal blood flow again. So they would need to go in and clear out the blockage or put a stent in for that patient. This is an irregular shaped descending aorta. So here's your descending aorta, and then right here is a rupture within that. So the most common site for tearing in a traumatic aortic rupture is the proximal descending aorta, which is right here, proximal, distal. So causes can be from trauma, there can be genetic conditions, atherosclerosis, which is hardening of the arteries, or problems with the aortic valve. Those could all be reasons for that rupture. This is a pulmonary angiography, so we're looking at the blood vessels in the lungs. So you can see where it branches off into the right lung and the left lung, and you can see all the pulmonary arteries here on each side. And then this next one is actually a pulmonary embolism. So this one is normal, and this one has an embolism. So a pulmonary embolism is a blockage in the pulmonary artery in your lungs. So the pulmonary embolism is caused by a blood clot that travels to your lungs, usually from the deep veins in your legs. But as you can see here, it's causing a blockage, and the blood is pooling in here, which is making it look wider than it did on the original, and you're not able to visualize those blood vessels. So here's the side-to-side comparison. Look at all of the vessels in the lungs on the normal one. I love these. They kind of remind me of tree branches. And then here you've got it all pooling because there's a blockage. So this is an animated image of a Greenfield filter. So the Greenfield filter traps blood clots. So what they do is they put it in here, and it stops this clot and catches it before it travels up to the vena cava, preventing it from reaching the lungs. So it allows the blood to flow around the clots, but it stops the clot itself. And this is what it looks like on images. I don't know if you can see that or not. It's kind of hard to visualize, but so you can see it right here on this AP image of the abdomen, and then here on the lateral you can see it. And a lot of times we would do these images to find the filter before MRI. They used to not be safe for MRI. Some of them are now, and some of them aren't. It just depends on what type they are. So we would do a lot of X-ray imaging prior to that. So this is a renal angiogram, angiography. So you can see here is the outline of the kidney, right? And then you've got all of the blood vessels going into the kidney and the arteries. So what they're looking for usually is a rupture or a blockage or any kind of diseases, like the possibility of a tumor. So the renal ruptures are usually pretty rare, but I'll show you one in just a couple slides. This one is a kidney again, so here you can kind of see the outline of the kidney, and then you can see the blood vessels in the kidney. But within these arrows, so here all the way through here and up to here, is a renal mass. And usually you can tell that because there's the increased vasculature. See how much, like, all the different vessels that are intertwined here and here, they just look black because of the contrast is so overlapping. So this right here is a renal mass. This one here, you can see the contrast coming in and then it just suddenly stops. See on this side how it branches out? On this side it just stops. That's a artery rupture from trauma. So those ruptures are very rare, but they are severe. Most of them are going to require a nephrectomy, which is the removal of the kidney. These are just upper extremity angiography. So here you've got, your shoulder and arm. You can see all the blood vessels. This one you can see the anatomy behind it. This one it's hard to depict what it is, but it's actually a wrist. I can see the radius and ulna here, but they've subtracted it. They've used that digital subtraction to kind of move the bone so you can just see the blood vessels. And then this is a hand. So thumb, fingers, and then the palm here back down to the wrist. These are the femoral arteries. So right here on the right femoral artery, you've got an embolism. So the blood flow's just stopped right here. See how it continues to go on this one, and it just suddenly stops right here on this side. This image has been digitally subtracted. I mean, you can still see the ribs and it's not as bad, but you can still kind of visualize it right there. So again, here is a aortic aneurysm. Again, it's in that proximal portion of the descending aorta. And here's another aneurysm, this big one right here on the end. So this is what it looks like. This would be what an aneurysm kind of looks like from the inside. So you've got the artery here, and then there's this big outpouching here. What's inside there right now is the coils, when I talked about coiling. So you can go in and you can coil off this aneurysm so that the blood will not flow into it. It'll just bypass it. And you can also just do the same thing in an artery as well. So I have a couple different videos here that I'll show you. Let me pull these up.
Is a flow diverting stent that allows us to treat previously untreatable select large and giant cerebral aneurysms. This animation shows a large aneurysm off of an intracranial carotid artery. We get past the aneurysm through the carotid artery with a microcatheter. Through the microcatheter, we deliver this pipeline embolization device, which again is a flow diverting stent. It's brought up through the microcatheter and then unsheathed across the neck of the aneurysm within the parent artery, which in this case is the intracranial carotid artery. The stent bridges the neck of the aneurysm completely. We then bring up the microcatheter up through the stent and capture the delivery wire and remove the whole system out of the patient's body, obviously leaving the stent across the neck of the aneurysm. In effect, this stent immediately causes stagnation of flow and decreased flow within the aneurysm, as you can see with this simulated angiogram. With time, over a matter of 2 to 6 months, the aneurysm will completely clot off and shrink away, essentially forming a normal blood vessel.
So that first video, they don't do the coiling. They use that stent as like a sheath to slow the blood flow. So the aneurysm's still not getting the pressure, and with the pressure relieved off of it, it can slowly shrink back down. This next one is of the actual coil. I don't believe there's any sound on this one. So it shows, the guide wire coming in. So there's the blue part is the catheter, the guide wire's coming in, goes up to the aneurysm. And then what they're going to do is kind of pull that back off just a little bit. So this is actually right now what they're showing you is a live version of a angiography procedure. So it's got the contrast in there. So you can see the wire catheter coming up through here. So they're going to go past that. It's nice and slow. Then they're slowly pulling it back just a little bit here. And they're going to go back to the annotation. And they'll zoom in here in just a second and kind of show you up close. I know it's kind of hard to see. So here comes the coil wire. This one's just the stent. So again, this one's kind of similar to that previous one where they're actually slowing the blood flow from going in there. Then they're going to put the guide wire in there with the coils, and they go back and forth, sorry. So you can see the wire coming in here as it's starting to coil up inside of the aneurysm. And they'll go back to the annotation in just a second so you can see it. It's kind of slow and melodramatic. So then the stent is holding the coiling in place so it keeps it. So they're just going to fill that entire aneurysm with the coils until it won't allow blood flow and pressure to go in there. So I feel like it's kind of cool how they can put those coils in there to keep the blood from flowing out of there, which will help, that from rupturing or causing any issues. So again, here is an image with an aneurysm here, and then after the aneurysm has been treated. So either with the stent over time to release the pressure and allow the aneurysm to shrink back down, or with the coiling, and the reason that you wouldn't see it, this is filled with contrast right now. If the coils are there, the contrast can't get through there, so you wouldn't be able to visualize it on the image. This is a posterior knee mass, so you can see the blood vessels here, but then you can see the vasculature around this here. This is a mass right behind the posterior portion of the knee, right where it bends. This is a small hemorrhage in the ankle right here. And this is a vascular midbrain tumor. So you're not able to see all of the blood flow because the tumor is blocking it. And then this is just two ankles with digital subtraction, so you can see the blood vessels down into the ankles and the foot, but they've kind of removed the bone so it's a little bit easier to see. And one more time here, this is cerebral angiography with DSA, the digital subtraction. So they've taken away most of the bone and the soft tissue so you can see the blood vessels within the brain pretty well. And here they've inverted it a little bit, and done some digital subtraction, but they've left more of the anatomy. This one, all you're seeing is the blood vessels. So that's it for the images. So you can visit the websites if you want to get more information on them. And I believe there's a couple videos on JetNet as well. If you want to see those. I think one's on pediatric angiography.